First and foremost, I want to thank NPCA and everyone for joining us on this call for these very, very important and much needed conversations. I have the pleasure of providing a summary of the town hall meeting that focused on policy changes for the future of Peace Corps. Michael Eric Dyson once said, "For much of American history, race has been a Black culture's issue. Racism, a Black person's burden. Substitute Black with any other person of color, you've got the same problem. Whiteness, however, has remained constant, the unchanging variable, the silent unchanging variable." The health and safety of volunteers is Peace Corps' stated mission, yet Peace Corps continuously falls short on this in health policy enforcement, ignored racial injustices, and stigma associated with mental health needs of the volunteers and staff dealing with such issues. On the town hall meeting, our PCVs came together and discussed the following changes that they would like to see. We want for there to be an evaluation and recalculation of the recruitment process with a focus on engaging more Black, Indigenous, people of color, especially from low-income communities. Break down the financial and educational barriers and conduct more community recruitment, not just in colleges. Understand that financial barriers that existed before Peace Corps will continue after service. Therefore, provide the support to be successful in continuing the Peace Corps mission at home. This includes, of course, looking into things like the readjustment allowance policies, job protection for skilled workers who enter service, livable disability pay for those who are injured in service, expanded healthcare coverage, and robust mental health resources before, during, and after service. Be intentional in policy creation and reform, and of course, providing supportive policies that address race and racial inequities. Mental health needs of those dealing with racial injustices are often ignored, and of course, other crimes as well. And so this is the reason why we need more focus on mental health. We also want Peace Corps to be more transparent in their recruitment process about the potential for things such as racial and other mental health issues that may arise as a result of service. But most importantly, prioritize the reports of racial discrimination and establish disciplinary action steps to address them. All crime against humanity needs the same level of attention and response. We also discussed implementing and enforcing the laws that are passed. For example, the Sam Farr-Nick Castle Act to improve the safety and health of volunteers. We want hired, qualified professionals to address the health needs of our volunteers, including psychologists in the countries to address the mental health needs. Make racial equity a priority. Set up programs, trainings, and staff support needed to address these issues and keep Peace Corps relevant for the future. And last but not least, stop the cycle of structural racism. Silence and silencing of volunteers who raise these issues must stop. Face the truth about what was created and remake it to be more in line with the external identity of diversity and equity within the Peace Corps. I just want to leave this as food for thought. Black, Indigenous, people of color are victims of all types of crime, yet in the Peace Corps, their non-white racial identity and its possible connection to the crime that they experience is always ignored. We must name it to change it. Robin DiAngelo wrote in her book, White Fragility, that suspending individuality to focus on group identity is healthy for white people. Doing so has very different impacts of people of color. Racism is a public and global health issue in as much as it is a human and social issue. Now that the broken system has been identified, it is time to take action. As Ken Good said, one of the panelists on that town hall shared, change is possible in the Peace Corps. We have to build a broad base of consensus and willingness to move forward and stay on it. Thank you.